Hi, my name is Miranda O'Rourke and I'm a student nurse practitioner and I will be doing your exam today. I'm going to go ahead and wash my hands. Can you tell me your name and date of birth?
Becca J. 11/29/86.
All right, Becca, do you mind if I call you Becca?
Mm-hmm.
All right, I'm going to have my medical assistant take your vital signs, your height and weight, and I read that you were here, chief complaint for fatigue times 6 months. Patient is female, she is pleasant, she is ANO times 3. I'm going to start this exam. I'm going to take a look. I'm going to be touching. We're going to start at your head, go to your eyes, ears, nose, mouth, and then your neck. Is that okay with you?
Mm-hmm.
All right. I'm going to go ahead and get up, take a quick look. Patient has blonde hair. Sorry, my hands are cold.
It's okay.
A little bit of dandruff is noted. No infestations. Don't see any discolorations. I'm going to go ahead and feel. No masses. Do you feel any tenderness?
Mm-mm.
All right. Hair is equally distributed. Head is normal cephalic. And then I'm gonna check you for TMJ. I'm gonna get behind you. I'm gonna put my hands on your face again. All right. Go ahead and move your jaw side to side. And clench your jaw for me. All right. Muscle tone is bilateral, symmetrical. All right, now we're gonna take a look at your eyes. All right, go ahead and blink for me. Your the eyelids do close completely. Eyelashes on top point up, eyelashes on the bottom point down. Eyebrows are bilateral. All right, and I'm gonna touch, pull down. Sclera is white, conjunctiva is pink. There is no extra moisture when I push down on the lacrimal glands. We're gonna do some eye exams, okay? I'm gonna give you a note card and you're gonna put this over your left eye. I have a chart right behind me. Go ahead and read with your right eye to the furthest level down that you can.
E F P T O Z L P E D P E C F D E D F C Z P.
Okay, go ahead and do it with your other eye.
E F P T O Z L P E D P E C F D E D F C Z P.
Perfect. Both sides are 20/20 vision. I'm gonna go ahead and grab my pen light and we're gonna do a little bit of light reaction. I'm gonna go ahead and measure your eye. We got a size 6. I'm gonna start with the left. Pupil is round, reactive to light. We're gonna go ahead and do it to the right eye. That side is also started at 6 and constricted to a 4. Bilateral eyes are reactive and equal to light. All right, and then we're gonna do another eye exam. You're gonna go ahead and follow my pen light. All right. No extraocular eye movement, no nystagmus noted. All 6 visual fields are intact. All right, we're going to start with your left eye. All right, the red reflex is present. The optic disc is seen. It is orange in color. Retina is intact, no opacities, and the vessels can be seen in the left eye. I'm going to go ahead and do the same with the right eye. Red light reflex is present. The optic disc is visualized. It is orange in color. Retina is also visualized intact, and the vessels are also seen in the right eye. Now we're going to move on to the ear portion of the exam. Have you had any problems with hearing? All right. And then I'm just going to touch. Any tenderness? Ears are bilateral. Patient has 2 earrings present on both ears. Then we got the tragus that lines up with the inner canthus of the eye. Now I'm going to take a look inside of your ear. I'm going to start with the left one. Pull up and back. And let me know if there's any tenderness, okay? If you could just tilt your head to the side. Alright, the tympanic membrane is visualized. It is gray and clear in color. The cone of light is visualized at 7 p.m. on the left side. And then inside is pink. We're going to go ahead and go on the right side and do the same thing. Up and back. And then the tympanic membrane is intact. It is pearly gray in color. And then we got the cone of light present on the right side at 5 p.m. And then also we would have the medical assistant do a hearing test on you. That includes the whisper test, the Weber test, and the Renee test. All right, I'm just gonna clean the scope now, and we're going to do an exam on your nose. Have you had any recent changes in smelling or taste? All right, nose is symmetrical. Is there any tenderness? All right, and then with the nose, we're also gonna palpate. Any tenderness? How about up here? All right, and then I'm going to take a look inside. All right, mucosal membranes are dark pink. They are moist inside. There are no polyps, no septal deviation on this side, and nare is clear of any blockages. We're going to go ahead and look at the right side as well. Mucosal membranes are also pinkish red. There are no polyps, no septal deviation, and this nare is also clear. Right, and then I'm going to also test the patency. I'm going to put my finger on your left nostril, go ahead and breathe into the right. And then I'm going to do the same thing on the right, go ahead and breathe in. Any trouble? Perfect. Now we're going to move on to the mouth portion of this exam. Lips are symmetrical, pink. Go ahead and open. Can you say ah? Alright. Tongue is go ahead and stick your tongue out. Tongue is midline. We got bilateral tonsils noted. Uvula is midline. Say ah. Gag reflex is present. Buccal mucosa bilaterally pink and moist. There are no lesions. Soft palate, pink and moist. No lesions on the tongue or anywhere in the mouth. No bad breath noted. Patient articulates words just fine. I'm going to take a quick look at the tongue. Use a gauze. No lesions. Tongue is pink and moist. No white patches. Alright, and now we're going to move on to the neck portion of this exam. Do you have any issues with range of motion? Alright, I'm going to have you look all the way to your left, all the way to your right, all the way up, all the way down. Was there any issues with that? Alright, mobility is bilaterally equal. I'm going to go ahead and palpate your lymph nodes now. Let me know if there's any tenderness, okay? We're going to start actually up here. Any tenderness? Alright, and no swelling is noted in any of the lymph nodes. I'm going to go ahead and feel for your trachea. Go ahead and swallow. Trachea is midline. Thyroid is present. It is not enlarged. Checking the patient for any jugular vein distension, which she does not have any. I'm going to check your pulse over here. +2. I'm going to go ahead and check the right side. Also +2. And then I am going to take a quick listen. All right, no bruises are hurt on either side. And now we're gonna have you shrug your shoulders, and then I'm gonna place my hand, go ahead and turn as hard as you can. Same thing with that side, and muscle strength is great on both sides. Go ahead and puff out your cheeks for me. Perfect, symmetrical, go ahead and smile. Smile is symmetrical, facial muscles are bilaterally symmetrical. Go ahead and raise your eyebrows for me. Eyebrows raise bilaterally symmetrically. All right, and this will conclude our exam for the head, eyes, ears, nose, and throat.